Good morning, everyone. Welcome to TeleShadowing. We are live on YouTube. Feel free to ask questions in the chat box as we go along, and your questions will be addressed. So we're going to be continuing our biochemistry and clinical applications month. Basically, our bootcamp style or a pathway to medical education of the first 2 years of preclinical curriculum in biochemistry. So today's topic is actually going to be on nutrition and vitamins. They're very important, high yield, and there are many different diseases that are associated with having too little or maybe too much of a certain vitamin. So remember let's go back to our basic principles. So remember homeostasis and what is physiologically normal. So remember that I just imagine like a seesaw when I'm thinking of, okay, when we're checking a patient's labs or we want to see what types of vitamins and or vitamin deficiencies a patient may have, these are the principles that we will go by in terms of the different diseases I'll talk about. So we're going to first discuss essential fatty acids. You may have already learned about it in biochemistry in undergrad, as well as maybe for the MCAT. Then we'll talk about a little bit on dietary supplements and really like there's so many supplements out there. What are the ones that are actually useful, or are there any, studies done for them? So I've always been curious about that, and I learned a little bit about it in med school. Then we'll be talking about vitamins and their specific disorders, and then we'll talk about protein-calorie malnutrition. As we know, a lot of the world is, unfortunately, there's still world hunger. So that actually lends itself to many diseases, and one of them includes protein-calorie malnutrition. So essential fatty acids. So I'll also have our undergrad student, Amna. She recently took the MCAT and applied to med school, so it's much more fresh in her mind, basically the organic chemistry behind it all. But basically, if you start off with the main two categories of fats, you'll remember that there's saturated and unsaturated fats. So saturated fats are basically fats that are solid at room temperature, and they don't contain any double bonds in their carbon chains. And so that's why they're considered to be saturated with hydrogen atoms, because remember, double bonds will reduce the opportunity for another hydrogen to bond with it. So if there are no double bonds, and that is what a saturated fat means, there's no double bonds and there are more hydrogen atoms, therefore it's more saturated with hydrogen atoms. And these fats are more commonly found in like animal products like butter, cheese, fatty meats. Then there's unsaturated fats on the right hand. They, on the other hand, they have at least one double bond in their carbon chains, and that causes a kink in their structure, and that keeps them liquid at room temperature. So these fats tend to be healthier, and they're found in plant oils, nuts, seeds, and even some fish. So remember, unsaturated, I would always get this confused. How I would remember it is basically saturated fats mean saturated with hydrogen atoms, and unsaturated just means the opposite. So that would mean that if saturated fats mean saturated with hydrogen atoms because there are no double bonds, that basically means unsaturated fats have double bonds. And so they are unsaturated or have less saturation of hydrogen atoms compared to the saturated fats. Hope that made sense. So within the unsaturated fats, in this flowchart I made, you have monosaturated fats. They contain just one double bond. They're found in olive oil, even avocados, some nuts, and they're known for their heart health benefits. And then polysaturated fats contain actually two or more double bonds. So monosaturated, just one only, and polysaturated, I guess you could say two or more. They're actually where we find the essential fatty acids. They're further broken down into omega-3 or N3 and omega-6, also called N6 fatty acids. The reason why, there are another names for these N3 and N6 or omega-3 and omega-6 fatty acids is because, well, you can correct me if I'm wrong, but I think it's because there's basically a double bond on the third carbon atom. Yeah, that's right. Okay, so that's why. So for omega-3 polyunsaturated fatty acids, they have a double bond on the third carbon atom. Remember, nomenclature, again, is very important. Remember, in the MCAT organic chemistry books I'd be reading, like nomenclature really tells you where everything is, where the map is laid out for the specific structure of a molecule. So, and then omega-6, again, the double bond is found on the sixth carbon atom. So, omega-3 fatty acids, they're primarily anti-inflammatory and they help reduce the risk of heart disease. And the first double bond in the omega-3 fatty acid occurs again at the third carbon atom from the end of the fatty acid chain. And so, some good sources of omega-3 polyunsaturated fats include fish oils and also flax seeds. Omega-6 fatty acids, they're more pro-inflammatory and they're involved in the immune response. So again, the first double bond in the omega-6 fatty acids is located at the sixth carbon atom from the end of the chain, and they're found in sunflower and also corn oil. And in contrast, like if you've heard of trans unsaturated fatty acids, trans unsaturated fatty acids tend to be found in fast food, and they promote cardiovascular disease, not health, disease, because the trans unsaturated fatty acids actually increase the LDL and decrease HDL. So I remember learning this in my physiology classes at undergrad. Basically, they say that LDL is the good cholesterol and HDL is considered quote unquote bad, but you still need HDL in your body. So that's a bit of a misnomer. So again, here, these are both types of the polyunsaturated fats, the omega-3 and the omega-6. They refer to the position of the first double bond from the methyl, a methyl group is a CH, right? A methyl group is a carbon atom with hydrogens on the four bonds of the carbon atom and of the fatty acid chain. And then the omega-3 is basically, you can see here, the first double bond is located at the third carbon atom from the methyl end. And same with omega-6, the first double bond is found on the sixth carbon atom. So that's why it would be called N6. So these structures, I guess you could say the differences in both of these structures, they affect the function of both of these in the body. Like omega-3 fats are generally anti-inflammatory and they support heart health. And then omega-6 fats, like I said before, they're more pro-inflammatory and they're involved in immune responses. As you know, our immune system is always working, always turned on. So we do need some pro-inflammatory benefits. And they're both essential fatty acids, meaning that they must be obtained through the diet. So essential basically means essential that something that we don't synthesize. So basically, like since these are both omega-3 and omega-6 fats, they're both essential. That basically means that they need to be obtained. They can only be obtained through the diet because the body cannot synthesize them. So for example, like I personally take like fish oil tablets. They're very healthy for you, very good source of omega. And now I'll talk a little bit more about essential fatty acids because they're very important components of our diet since our body can't produce them and we need them for many different processes. And we'll learn that in our metabolism lectures coming later this month. But the fatty acids basically help build and they maintain our cell membranes, and they're very important for like various physiological functions, including like regulation of inflammation and also our cholesterol levels. And you can primarily get them from like nuts, seeds, oils, fish. And that really tells you it's very important to have a balanced diet rich in these types of nutrients. And then omega-6 fatty acids, specifically the linoleic acid, like I said before, omega-6 is very important for the inflammatory processes. But basically, like once it is ingested, the linoleic acid is basically converted to arachidonic acid, and that's basically the foundation of molecules like leukotrienes and prostaglandins. And there are a lot of pharmacotherapy applications for prostaglandins and leukotrienes. And these compounds are very important for like immune response, inflammatory regulation. And so that's why these fatty acids are super important. But over consuming something, of course, over the seesaw method, like you don't want too much of even if it's a good thing for you. Like again, you want to have a balance. You want that seesaw to just be in a balance. And that's basically what homeostasis is. So like having too much of this can also contribute to excessive inflammation. So the balance is very key to having the right amount of omega-6, like not like overdosing on your fish oil tablets in the long run. So again, very important. And there are reasons, there are a lot of clinical applications to these, which is why it's so important to have a foundation in the organic chemistry molecules to understand that as it builds, when you learn more about different reactions that occur within the body, and then also in metabolism and how we actually metabolize different medicines or drugs that we receive, and also how the normal molecules in the body, not from extravenous sources, exogenous sources like drugs or medications or pharmaceuticals, but even what's happening naturally in our bodies. And sometimes our bodies might not be breaking down something like it needs to, and that can lead to a disease. So remember, we started on the cellular level, and it obviously microscopic implications if they're done enough, or if the body replicates a specific cell that is not breaking down omega-6, for example, that it needs to, and it replicates that cell, then you would see some macroscopic implications. So again, the balance is very key. And then omega-3 fatty acids like linolenic acid, it's well known for its like heart protective benefits. A lot of studies done show. So basically, like omega-3s really help prevent or reduce the harmful LDL cholesterol levels, and it increases the beneficial HDL cholesterol levels. And that plays a huge role in reducing the risk of various cardiovascular diseases like heart attacks or atherosclerotic plaques. And in contrast, like trans fats, they're often found in the processed or fast foods. They have the opposite effect. They damage your heart health by raising the bad cholesterol and lowering the good cholesterol, you could say. So the bad is considered like I think LDL, I think I misspoke before. LDL is considered the bad one, but either way, it's not like both are super bad. It's just a matter of like, this is sort of a misnomer, I would say, like good versus bad cholesterol, because you do need both, but at a specific ratio or balance. Like you want to have more HDL than LDL. Having too much LDL would make it bad. That's why people say you want to have lower LDL levels, not lower your HDL levels. So I just wanted to correct myself there. So, this is why you need to prioritize like healthy fats in our diets, not always be eating, fast food. Now I'll talk a little bit about dietary supplements. If you go to any like Walmart or CVS, you'll see like lots and lots of shelves of dietary supplements. But there's always a disclaimer if you, take like a box of multivitamins or really anything on those shelves. It usually says that the FDA has not evaluated whatever claims that these specific supplements may have. Now, there are a lot of like, for example, like fitness influencers or YouTubers. The celebrities also tend to promote their own dietary supplement brands, but unless they are scientifically, proven to work or regulated by the FDA, the FDA is an acronym that stands for the Food and Drug Administration, which is basically how the United States sort of regulates the safety profiles of foods and bans harmful, things that should not be in our foods, and basically sets the standards for food in our country. The FDA actually does not evaluate dietary supplements, whereas the FDA, if there's any like pharmaceutical that's used to treat diseases, that also goes through the Food and Drug Administration, because remember, food and drug, so drug including the pharmaceuticals or medications. So, dietary supplements, they're basically taken to complement the diet and also provide nutrients that might be lacking. So, not like there's no place for these. I just mean like dietary supplements, such as like if you're taking it, if let's say I'm not eating fish in my diet, then it would be helpful to take fish oil tablets so that I get my omega-3s and omega-6s, because they're very important to my body function. So again, these dietary supplements, there are good ones, of course. They're taken to complement your diet, and provide the nutrients that might be lacking. So some diets have specific supplementation needs, as seen in this table. Like if you are a vegetarian or a vegan, you would need to supplement with like iron, vitamin B12, vitamin B2, and also sometimes vitamin D. And some other diets like a high egg white diet, or someone who eats like raw high egg white diets. Remember, like all of our patients, we're going to be treating very diverse patient populations. Some are vegan, some, might have diseases that might prevent them from being able to eat some or might have like egg allergies, for example. So you want to be able to work with the patient, not against the patient. So kind of working around their lifestyle, prescribing them or recommending that they obtain some good sources of iron if this patient is a vegan, for example. And also like some people also eat untreated corn. So, some people, not every country, washes their corn. You might have patients who come from different cultural or socioeconomic backgrounds where it's normal to eat, untreated corn. So then you would need a supplementation required like vitamin B3, which is very common in resource limited areas. So again, it's just very important to realize that, we will be treating patients that may, be immigrants or different countries, have traveled to different countries for long or extended periods of time, and you still want to be able to work with them. So, yeah, so that's why like even like so even if it's not untreated corn, like even corn-based diets, like specifically like untreated corn, that can actually lead to a deficiency in niacin, which is vitamin B3, which is very common in the resource limited areas or geographic countries around the world. And again, the raw egg white diet, anyone who takes that might need biotin supplements because there is actually something called avidin in the egg whites, and that it binds biotin and prevents absorption of biotin. You just kind of excrete that biotin. So you might need like a vitamin B7 is actually just another word, actually the vitamin term for biotin. You might have heard of biotin before in like hair, skin, and nails supplements. That's what I see a lot as a female. All right. So, like again, I said before, I alluded to this already. In the United States, the dietary supplements are regulated as foods, not drugs. So, there was an act passed in 1994, actually called the Dietary Supplement Health and Education Act, or DSHEA of 1994, and it basically allows supplements to be sold without FDA approval, as long as they are labeled correctly and are safe when used as directed. So the FDA actually steps in, well, only steps in after the product is on the market. So that's why it's very important for consumers to educate themselves and also try looking and if you are taking supplements, check if your supplements are USP verified, because that also helps indicate high quality and safety standards for the supplements, and always verify that what you're consuming actually meets your health needs. Now, everyone has different dietary needs based on their gender, based on their age, metabolic rate, basal metabolic rate, and how much they exercise, and overall lifestyle. We're all very different. It's very hard to say like the one specific right diet for you. No, I'm not a dietitian, of course, but everyone has very different needs because we all have very different ways we absorb foods. We all have a different microbiota in our gut or our colon and our digestive system. So no two would be alike, because the way our flora are established also determine like it reminds me of the words like you are what you eat. So again, like there's no such thing as the one single perfect diet because everyone's needs are very different. People react many drugs have different adverse reactions, but some people get reactions, some people don't. It's because we all have different ways we metabolize different drugs and things like that. Like I don't know if you'll all remember earlier this year we talked about cytochrome P450 or CYP450, and that's basically one of the major metabolizers of pharmaceutical drugs, but you don't have to worry about that for now. Um, and well, like supplements, they can be very helpful when they're used appropriately, of course, and they fill in your nutritional gaps or support like specific health needs. Like vitamin D is very commonly supplemented in regions that have limited sunlight exposure, but they do have risks. Like if you do overuse like fat soluble vitamins, it can actually lead to toxicity since the vitamins would just accumulate in the body. And also some supplements can also interact negatively with medications. So that's why it's very important to report all the supplements that you may be taking to your doctor's office. They actually ask you in their intake forms, like what medications are you on and are you taking any supplements? Because sometimes supplements can also affect your lab values if you are getting your routine labs done. So there's actually something called the St. John's wort, and that can actually reduce the effectiveness of antidepressants. And that's like one example of a supplement that can reduce the efficacy or effectiveness of some specific SSRIs or antidepressants used to treat depression. So remember, like as consumers, we need to remain like informed like cautious, especially since the FDA does not regulate the products before they hit the market. So with that all said, now I'm going to get into really the meat of the presentation for today on vitamins and disorders. So remember that the role of vitamins, they play many different roles. Like why do we actually need them to begin with, right? They're needed for metabolism, for immunity, and also for our cells to repair themselves. So they play a major role in maintaining our proper healthy homeostasis. And vitamins, they're basically divided into two categories that you'll see here. There is fat soluble and also water soluble. So fat soluble vitamins include vitamin A, vitamin D, vitamin E, vitamin K, and they're stored in the body's fatty tissues, and they can accumulate to toxic levels if they are consumed like in an excessive amount. And then there's also water-soluble vitamins, such as like the B complex vitamins, including vitamins B1, B2, B3, B5, B6, B7, or we said B7, vitamin B7 is biotin, vitamin B9, and also vitamin B12, as well as vitamin C. They're generally not stored in the body and they tend to be excreted in the urine. So, therefore, the water soluble vitamins need to be replenished more frequently. But there is one vitamin that is stored in the liver, which is an exception. It's not always excreted. It's vitamin B12 that tends to be stored in the liver. So, the water soluble vitamins, they dissolve in water. They're not stored in the body for long periods of time. Like I said before, vitamin C and also the B complex vitamin. Okay, I'm back. I think my internet just had a second of refreshing. But as I was saying before, that again, it's very important to replenish our vitamins, and there's a really good resource in I think the Harvard University website that actually tells you based on your age and your gender and your dietary needs in terms like, how active you are, what vitamins you need. But also if you can just also check like what is the average um, caloric intake slash vitamin intake, vitamins and minerals intake that we need every day. So it's very important to just know that. And then you can just be more, the more aware we are about what foods we should be eating, the easier it tends to become to just be eating the right things. Even if we are, occasionally having dessert or fast food, to just make sure that we're replenishing ourselves of what our body actually needs. So again, it's important to have these water soluble and also the fat soluble vitamins. So the fat soluble vitamins basically they dissolve in fat. That's why they're called fat soluble, and they require dietary fats for absorption, and they're stored in our body's fat reserves, and they're not excreted as easily as the water soluble vitamins. And since they can be stored in the body for long periods of time, the fat soluble vitamins A, D, E, and K, they don't actually need to be consumed as frequently, but some people do need vitamins prescribed to them, but they can accumulate in fat, and that can lead to some toxicity. And it's very important to monitor your intake of the vitamins, especially when you're like taking supplementation of vitamin D. I see a lot of like geriatric patients, they tend to be prescribed vitamin D to promote the bone health, because as you get older and you grow older and you become a little like I guess like 60 plus, 70 plus, when bones just break much more easily, and there's higher chances of osteoporosis and bones just breaking after a fall. So vitamin D really strengthens those bones. Now let's talk about vitamin B1 and its related disorders. So basically, if you don't have vitamin B1, it can lead to all of these diseases that I listed here on this PowerPoint. So on this slide, actually. So like if there is like impaired glucose breakdown, it can lead to ATP depletion that's worsened by a glucose infusion. And so the highly aerobic tissues like the brain or the heart, they're affected first. So in patients that have chronic alcohol overuse or malnutrition, you would have to give them thiamine before dextrose to decrease this risk of precipitating Wernicke's encephalopathy. And you can actually diagnose this. Actually, I won't get a diagnosis. That's a little bit complicated, but basically, vitamin B1 is very important for the energy metabolism, especially in the high demand tissues, such as the brain and the heart, like I was trying to explain before. And so, if there's a deficiency, deficiencies usually tend to be caused by like chronic alcohol use or malnutrition. And that can basically lead to the serious neurological and also cardiovascular conditions. So, Wernicke's encephalopathy, it's basically this acute and life-threatening condition that's characterized by confusion, ataxia, and also like eye movement abnormalities. And if it's left untreated, it can actually progress to Korsakoff syndrome, and that actually is known to have like severe memory deficits. And there's another disease called dry beriberi, and that affects the peripheral nerves, while wet beriberi, that leads to heart failure. So again, like these are all the related disorders for vitamin B1 or thiamine deficiency, or even sometimes having too much of it. Um, Here I think, yeah, so basically, like this is again a screenshot from our first aid book. Basically, it's like you can consider it like the number one guide book, Survivor's Guide to Passing Step 1. That's basically our first aid book. And these are the different disorders that are affiliated with it. And in red, sometimes these are like mnemonics to remember it because we have to have all of it memorized. Now let's talk about vitamin D. So if there's a vitamin D deficiency, it can lead to something called rickets. And I'm going to actually show you, you don't have to, of course, understand all of it per se, but I'll just explain it a little bit. So remember, you can get vitamin D from the sun. And basically when the sun does shine, it let me see. So you can see here, yeah, in diet, you can also get vitamin D from dietary intake. So from sunlight and also dietary intake from in the form of vitamin D3, which is through fish or meat, and vitamin D2 through supplements. That supplement is called ergocalciferol. So both of these types of vitamin Ds, they're actually converted to 25-OH-D3, which is the storage form of the vitamin D in the liver, and then it can actually be converted to the active form or calcitriol in the kidney. That's basically what this figure is saying. And here, if there's an increased absorption of calcium and phosphate, basically these are all feedback loops. I'm sure you're familiar with them from the MCAT. There were a couple of feedback loops that they would teach you about, especially throughout undergrad if you took any bio classes, where basically a feedback loop is if you have too much of something, it can sort of inhibit something, or if there's too little of something, it can actually kickstart something to be made. So this is where all your hormones and really amazing, like how your body is able to sense what you're missing in the body and what you need and what you need to make more. So these are just feedback loop examples. So if there's too much of vitamin D, it can just get excreted in the urine. Or if there is if your bones need it, then basically vitamin D3 would inhibit PTH or the parathyroid hormone from telling the bones to like keep making more, if that makes sense. So that's basically what this is all summarizing. Like there would be more mineralization of the bone if there are low levels of vitamin D, and there would be increased bone resorption at higher levels of vitamin D. So what that means is like your bones will basically reabsorb vitamin D, if my understanding is correct, at higher levels. And here, like the diagram over here, it's basically telling you again, like the activation pathway of vitamin D and how it plays a role in calcium and phosphate balance. And I'll show you the visual, like why, how, how do all these graphs sort of make sense and why do they matter? Because again, like I said before, like vitamin D is obtained from the diet or through like a supplement like ergocalciferol, and vitamin D2 or synthesized in the skin is cholecalciferol, and vitamin D3 through the sun exposure. And both forms are converted in the liver to 25 hydroxyvitamin D, which is done by the enzyme 25 hydroxylase, and then it's finally activated in the kidneys, where that 25 OH vitamin D3 is converted to its active form, which is a very long name, 125 dihydroxy vitamin D, by the enzyme 1-alpha hydroxylase. And so the active vitamin D will decrease the calcium and phosphate release from the bones, and it would increase the calcium and phosphate absorption in the intestines. And the reabsorption of calcium in the kidneys will also promote phosphate excretion. And all these like phosphate, calcium, all these ions play a major role in our cell membrane, and membrane potentials in the brain, in the heart, and really phosphate levels, and it supports bone health and also other physiological functions. So, rickets tends to happen in children. It's a deformity called sometimes bow legs, and also, and if it happens in adults, it'd be called osteomalacia, which is referred to as bone pain and also muscle weakness, and is also sometimes called hypocalcemic tetany. And rickets is basically caused usually by malabsorption, decreased sun exposure, poor diet, even chronic kidney disease, because you saw before the role the kidneys play with vitamin D, and also advanced liver disease. So you would want how you treat is that you would give oral vitamin D supplements to like breastfed infants, and if someone has darker skin and or prematurity, it may predispose someone to having this deficiency. If someone is premature, they're growing too fast, or maybe growing too fast to the point where the vitamin D that's needed for bone health can't keep up. So again, like I said before, vitamin D is very important for calcium phosphate absorption, which are like very important for healthy bone development. So if there's a deficiency in this or it is not enough, it can lead to rickets in children, which is a condition where bones become soft and weak and would lead to like skeletal deformities such as bow legs. And this condition is usually seen in children who have like limited exposure to sunlight or those living in areas with not enough vitamin D. And rickets is still a global health issue, and it's especially prevalent in regions where malnutrition is prevalent. Now we'll talk about the fat-soluble vitamin deficiencies, including vitamin A deficiency. Vitamin A deficiency actually leads to, remember the fat-soluble vitamins are A, D, E, and K. So if you have a deficiency in vitamin A, it could lead to night blindness or dry skin because vitamin A is important for your eyes and eye health. Vitamin D deficiency, like I said before, like can lead to thin or misshapen, brittle bones. If there's a vitamin E deficiency, it could lead to hemolytic anemia or muscle weakness. And if there's vitamin K deficiency, it could lead to bleeding disorders, like neonatal hemorrhages, because vitamin K is important in and basically it's called oh yes, the clotting cascade. So it's very important there, is an important factor. So fat soluble vitamins basically play many roles in the body, and vitamin A, like I said before, is important for the immune health and also vision. And so if there's deficiency, it lead to night blindness, and vitamin E acts as a antioxidant, and that basically protects cells from oxidative stress. And vitamin K is necessary for blood clotting. So any deficiencies, any of these vitamins can have very major consequences like bleeding disorders or also oxidative damage to cells, which is why a vitamin E deficiency could lead to hemolytic anemia. And also let us look at water-soluble vitamins. So just to start off with like vitamin C deficiencies, it would lead to scurvy. So what I've seen is like when I'm preparing for this exam, like I see questions or if you see a patient who has like bleeding gums and anemia and also poor wound healing, that could be indicative of a vitamin C deficiency. And the B complex vitamins, they all have like their own functions and they play key roles in the cellular metabolism. So vitamin B12 and vitamin B9, B9 is folate, folic acid. They're essential for DNA synthesis, and vitamin B6 is important for the neurotransmitter synthesis. And besides vitamin C from being an antioxidant, it's also important for collagen synthesis, which helps in your wound healing and maintaining healthy gums. So if you have a deficiency in vitamin C, it could lead to a disease called scurvy, and that's a serious condition that compromises the integrity of many connective tissues. And so you would classically see bleeding gums or scurvy for scurvy. So let's do a couple of case studies now, very briefly, based on what we've learned today. So I will read this, unless Amna, do you want to read it? The case study?
Yeah, let me read it for you. Okay, case study number 1. A 25-year-old woman presents to her obstetrician for a routine prenatal visit at 10 weeks gestation. She reports no significant medical history and states that she has been following a vegan diet for the past 5 years. She admits to having inconsistent prenatal vitamin use due to nausea, but has recently started taking them regularly. Her physical exam is unremarkable, and the ultrasound shows a viable intrauterine pregnancy. However, at her 18-week anatomy scan, the fetus is found to have an open neural tube defect, specifically spina bifida. Which of the following is the most likely cause of this fetal abnormality?
Okay, so what do you all think? So if you just remember, like, why are prenatal vitamins so important? There's a really main one. And I don't want to spoil it. So what do you think, Amna?
I think I've heard of like folic acid tablet, like those prenatal folic acid vitamins.
Exactly. So remember I talked about vitamin B9, which is folate. That's C, right? So that's why the correct answer here would be C. So you're correct. It's very important for DNA synthesis and cell division. So that's why it's a lot of doctors really advise all females who want to have kids to start on folic acid supplements because they prevent neural tube defects. So a deficiency in folate during the early stages of pregnancy can actually impair the proper closure of the neural tube. That's why it's so important to know and understand embryology and embryogenesis, because the neural tube actually develops in the early stages of pregnancy. And folic acid really helps close the neural tube. Um, and so with a deficiency in folate, it can actually lead to neural tube defects such as spina bifida and anencephalopathy. And so pregnant women are always advised to take folic acid supplements before conception and during the first trimester to reduce the risk of these defects. And the patient's inconsistent use of prenatal vitamins, specifically the folic acid, might have contributed to the development of this neural tube defect. So it can be A, which says vitamin B12 deficiency, because this is more of a concern for patients who have like vegan diets, because it's more associated with megaloblastic anemia and neurologic symptoms in the mother, not necessarily like a neural tube defect in the fetus. Vitamin A excess also can't be correct because vitamin A, it can cause like terogenic effects, but it's not a known cause of neural tube defects. And finally, D can be at either. It can be vitamin D deficiency because this would actually affect bone mineralization. It's not really linked to neural tube defects. Now let's do case study number 2. I can read, or you can read this one. I'll read it. A 42-year-old homeless man presents to the emergency department with confusion, ataxia, and eye movement abnormalities. He has a history of chronic alcohol use, and on physical examination, the patient appears malnourished with a nystagmus and a wide-based gait. Neurologic exam reveals ophthalmoplegia and impaired coordination. He is started on intravenous fluids and medications. Which of the following deficiencies is most likely responsible for this patient's condition? Is it A, vitamin C deficiency, B, vitamin B1 or thiamine deficiency, C, vitamin B12 deficiency, or vitamin D deficiency? I'll give you a couple seconds to think about it. So the correct answer is actually B, vitamin B1 thiamine deficiency. So this patient is actually presenting with Wernicke encephalopathy, and that's a condition that's associated with a vitamin B1 deficiency. And so this encephalopathy or Wernicke's encephalopathy, it typically occurs in malnourished individuals, especially those who have like chronic alcohol use. And it's care and basically how you know it's Wernicke encephalopathy through the symptoms that are described here, the confusion, the ataxia, and the ophthalmoplegia. And if it's left untreated, it can actually lead to Korsakoff syndrome, and that actually involves irreversible memory loss and confabulation. So there needs to be prompt thiamine replacement. It would be critical to prevent any permanent damage for this patient. It can be vitamin C deficiency because that would lead to scurvy, like we talked about before, and that's again, we talked about that. That's more so classic for if this patient actually presented with like bleeding gums and also like bruising and poor wound healing because the collagen, the how it affects the collagen synthesis, it wouldn't actually really contribute to any like neurological symptoms like this. It can't be C, vitamin B12 deficiency, because this is more so like this kind of combines a degeneration of like the spinal cord and also megaloblastic anemia, like I said before, but not like these acute symptoms. Because you can tell it's acute because the man he presented to ED like with confusion, ataxia, and eye movement abnormalities. And the chronic alcohol use sort of is like a buzzword that stands out to me. And also like this patient had this is considered an acute onset because they just presented to the emergency department. It wasn't like a long-term thing or chronic. And it can be D, vitamin D deficiency, because that would result in rickets or osteomalacia, and because it's an adult, and that would affect bone health and not necessarily these acute neurological deficits. Now, case study number 3. A 3-year-old boy is brought to the pediatrician by his mother for evaluation of delayed walking and bowing of the legs. The mother mentions that her son has been mostly kept indoors due to concerns about his asthma, and he does not spend much time outside. His diet consists mainly of homemade food with minimal dairy intake. On physical exam, the child has bowed legs and a prominent forehead. X-ray of the legs shows evidence of osteopenia and metaphyseal widening. Which of the following is the most likely cause of this child's condition? So again, I don't know if it it should have you should have been seeing like red I guess like these I would highlight like, oh, there's no sun, right? No, if there's no sunlight exposure and there's reduced dairy intake, then that would mean that this is most likely a vitamin D deficiency, or the answer being C. Um, these are all the signs and symptoms of rickets. Because remember that vitamin D is so important for the calcium and phosphate absorption, which is important for bones to form or bone mineralization. And so if there's a deficiency in vitamin D, it could lead to softening of the bones. Remember osteomalacia in adults and rickets in children. That would result in the bowed legs, the delayed walking, and also the other skeletal abnormalities. And also the child who had like this child has limited sun exposure, and low dietary intake of vitamin D can of course contribute to this deficiency. So I feel like that was a very like obvious one, I hope, after our PowerPoint today. Like, and I don't want you to ever forget vitamin D deficiency causing rickets. It's very, very high yield. So it can be or vitamin A deficiency because that would cause visual disturbances. We talked about it for night blindness, skin changes as well, but not like bone deformities like we see in this case. Um, it also wouldn't cause vitamin C deficiency either because that would lead to scurvy. Remember the gum bleeding and poor wound healing, but and not the bone deformities. And it can't be D, or it can't be vitamin K deficiency because that would actually result in bleeding disorders like I guess you could say abnormalities with clotting and the clotting cascade, not necessarily the bone abnormalities. So I hope that made a little bit of sense, like that application of all the different vitamin deficiencies. Now we'll talk a little bit about protein calorie malnutrition. So malnutrition is defined as an at in basically it's defined as an inadequate intake of protein, calories, or both. So this is actually a map of the global, regional, and national burden of protein energy malnutrition, and is basically a systemic analysis from 2019 of the global burden of disease from that global burden of disease study, which basically shows you where there is more protein calorie malnutrition. So red would mean much more compared to like the population, and of course it's standardized by age. Um, you can see here a lot, I guess Mexico's a little bit lighter in the blue area, but I'm looking more at the yellows and reds, which is sort of here in Southeast Asia, South South Asia as well, and also some parts of Sub-Saharan Africa. And so protein calorie malnutrition, it basically occurs when there's an insufficient intake of protein and or calories. And this is a significant global health issue, specifically in regions that are affected by poverty, food scarcity, and like a lack of access to proper nutrition. And the two main forms of protein calorie malnutrition are kwashiorkor, which is, and I'll show you how it's spelled actually in the upcoming slides. It's hard to pronounce even. It's basically kwashiorkor syndrome is basically caused by a lack of protein, and marasmus, that's caused by a general like deficiency in calories. So both conditions have serious health implications, especially in developing children. So kwashiorkor and marasmus. So let's talk about that a little bit more. So protein calorie malnutrition occurs when there's an insufficient intake of protein and or calories, like we said before. This is a significant global health issue, like world hunger, especially in the regions that are affected by poverty. So in kwashiorkor, this is considered the disease that the first child gets when the new child comes, and marasmus is considered to waste away or die away, basically because kwashiorkor is basically caused by a lack of protein, and the marasmus is basically like having that deficiency in calories. So again, this is like this is more so referring to like a lack of dietary protein. So here kwashiorkor is included here in this sort of form, so to kind of understand it a bit better. Because it's a form of protein calorie malnutrition. I'll show you a picture of it in the next slide. That's characterized by edema, which is like swelling, which occurs due to the reduced. This is why it's so important to know physiology, because actually like if there's edema, it's actually caused by plasma oncotic pressures that are reduced because of the low serum albumin. And so albumin is very important um, for liver function. So it's something that leads to skin changes and also liver dysfunction because the liver fails to produce enough basically apolipoproteins, and that results in like a fatty liver deposition. And so clinically, children who have kwashiorkor, they often present with like swollen abdomens. And there's a mnemonic meals that can help you remember the key features of kwashiorkor: malnutrition, M for malnutrition, E for edema, A for anemia, L for liver issues, and S for skin lesions. So on this slide, you can actually see here the meals being applied. You can see on the right, you can see this distended abdomen, and you can see more so the ribs kind of sticking up. The abdomen is distended because remember the liver sits here, and that's a telltale sign of kwashiorkor. And here, marasmus, this is just a severe overall calorie deficiency where there's like a loss of fat. So marasmus is caused by this severe deficiency in calories and also energy. But unlike kwashiorkor, the marasmus actually doesn't typically cause edema or like that swelling of the abdomen that we saw in the previous slide. Instead, it actually results in the extreme like muscle wasting and loss of body fat. And that actually leads to like a visibly like emaciated appearance, I would say. Like children who have marasmus, they appear very thin and very frail with little to no muscle mass or fat reserves. And this condition represents this chronic state of malnutrition where the body is basically wasting away due to a lack of adequate caloric intake. Because if there aren't carbohydrates, if there isn't fat, what is the next source that the body is going to use for metabolism? It would use likely muscle. And after that, could definitely lead to organ failure because there are many organs that need muscles to function, like our hearts. So basically, the body essentially wastes away. And this is actually someone who is overweight can actually lead to this can eventually lead to death, starvation, like death by starvation. So, on that note, I hope that sort of made sense, the importance of nutrition and calories and a couple of diseases associated with the various vitamin deficiencies. So the teleshadowing quiz will be live soon later today on teleshadowing.com/certification. Remember that you can also take the prior teleshadowing sessions from previous years. We've opened up all the sessions. And next week, we'll be talking about the clinical applications of metabolism, like I sort of alluded to before. So I hope you're also super curious, sort of understanding the clinical relevance behind why do we need to know all this biochemistry? Why is it important to know all this? I think it's very rewarding when you're able to see patients and improve their quality of lives. So, thank you so much, everyone, for attending today's session, and I hope to see you at next week's.